There's 16 active cases of coronavirus in Victoria. That's 4 less than yesterday's update. There are no new local cases, no new hotel quarantine cases. One person remains in hospital. I'm advised not in ICU though. Today is the 6th zero day in a row, which is great news and a terrific statement of the commitment of Victorians to follow the rules and to get this job done. There were 18,282 test results received today. That's a very strong number, and we thank all of those people for going and getting tested. It is the most important thing that anyone can do. Even the mildest of symptoms, get tested, protect yourself and help us protect every single Victorian. There were 808 vaccinations that were administered yesterday, taking the total Victorian number of vaccinations administered since Monday or the beginning of the program, 2,063. So we intend to keep you updated as best we can each day with those numbers. But that rollout is a massive logistics task, but it's going well, and it's that sort of slow, steady, gradual work that has to be done so that we get the best outcomes for each of those cohorts. And as you know, the program expands. This is frontline workers and those who get tested very regularly, so those that are at highest risk, and that's all about a further defence against this getting into the Victorian community. I should just say that in relation to New Zealand, there's been some decisions made by our public health team and indeed by other states, and I think no doubt supported by AHPPC and the National Public Health Architecture. One flight has come to Melbourne, one green zone flight, and our public health authorities are in the business of contacting them, in the process of contacting each of the people that are on that flight, explaining to them that they need to isolate and get tested. That's an abundance of caution approach, and we look forward to those people doing as they're asked. That's a really important thing for all of us. Now, we're here at Dunlop Avenue in Ascot Vale to mark a really significant milestone in our big housing build. $5.3 billion in new money provided in last year's budget. That's on top of more than $1 billion that we'd already committed to invest, both in terms of maintenance and new build at the election in 2018. This is more than 12,000 extra units, so new units, an increase of 10% fully on the total social and affordable and public housing stock, if you like. This is about making sure that vulnerable Victorians have got a home, that we create jobs. That $5.3 billion is good for 10,000 jobs each year, every year, over the life of this program. It's a really significant investment. There were 80 very old, not fit for purpose dwellings on the site where we're standing now. And when construction is finished, and it's ready to begin quite soon, pushing right through this block here, there'll be 200 purpose-built, 7-star energy rated, lift assisted, open, bright, brand new homes for people who need them. This is great for jobs, it's fantastic for recovery, and it's also about making sure that those with the least in our community, those who are vulnerable, have the support and protection and the certainty that they need to have the best life possible. You'll also recall that we've reserved a number of places for those who live with mental illness. We've reserved a number of places for those fleeing family violence. And also, just as these buildings will be as disability friendly as they possibly can be, they'll be accessible buildings. We've also set aside a number of units for those who live with all manner of different impairments. It's about inclusion, it's about accessibility, it's about making sure that we support those who need it the most. Joined by Danny Pearson, of course, as the local member, and he's a very frequent visitor to this public housing estate. Proud local community, but a local community that does it tough, and these investments will make things just that little bit easier. It is a massive boost, the biggest in our nation's history, not just Victoria's history. This is more money than has been spent by any government, state or federal, in the history of our nation to boost public, social and affordable housing and to create literally thousands of jobs, and along the way, hundreds, indeed thousands of apprentices, trainees and cadets who will get their skills that they'll use for their whole working life as a result of this program. So this is what's been termed part of our fast start. There are 6 sites. This is one of them. Details are being finalised on, I think, one of those 6 sites, but we are making that fast start. There's about 1,000 dwellings involved in that program, plus there's nearly 1,000 more that are being spot purchased, so either properties that have been built and haven't been sold, properties that are partially constructed but for all sorts of reasons. Many of those will be driven by the pandemic. They won't be concluded. Settlements have fallen through. We're going to pick those up, and others that are approved, ready to be constructed but haven't been constructed yet. So this is a comprehensive answer to many different questions, not just stimulus and jobs for the pandemic, but also dealing with unfinished business to make sure that more and more Victorians who need secure, low-cost housing can get that, so that they can have all the life opportunities that we want for every single Victorian. It's also an investment. I'll just say this finally before I ask Richard to add to my comments with some of the details of the program. You know, whenever someone is without secure housing, particularly if they have a number of multiple and complex needs, they just finish up costing the taxpayer more. The cost of failure, the cost of insecure housing, emergency accommodation, poor health, hospital admissions, all manner of different challenges, they just get higher and higher, and all of us meet or have to foot that bill. This makes sense on every level, and we're delighted to have made a fast start on the big housing build, jobs, secure housing, and the coronavirus recovery that's so important now more than ever.